Very important part of life, and people who have a condition that affects their voice or communication abilities can work with a speech-language pathologist to improve their skills. Here today to talk about what a speech-language pathologist does and a new service is available to patients is Sarah Gromko, a speech-language pathologist at Hartford Healthcare. Sarah, welcome.
Thank you.
So what is speech therapy and what is the role of a speech pathologist?
Well, a lot of people, when they hear speech therapy, they think about people who work with kids with lisps or stutters or autism. But a medical speech-language pathologist deals with all aspects of an adult's communication. So we evaluate and treat people who have trouble with their voice, with their speaking, with their language, understanding and receiving language, as well as expressing it. And we also deal with even nonverbal communication, reading and writing, and then we go into cognition as well. So anything that would affect their communication that works in their brain, like attention, memory, thought organization, reasoning, and judgment. And we also deal with dysphagia, swallow.
And let me ask you, who benefits from these services?
Well, the common conditions that usually come to see us are stroke, traumatic brain injuries, even people who have had COVID. We also deal with people with Parkinson's disease and MS and dementia. And we deal with people who have any sort of voice issues, including aging voice. As we age, our voices change, and people with chronic cough, reflux, head and neck cancer, and even some cancer treatments can cause some problems that we would treat.
All right, tell us about some of the new speech-language services available to patients.
Well, Hartford Healthcare just opened our first outpatient speech-language pathology program in Fairfield County at our new Stratford clinic. And so, although we'll be treating everything I just mentioned, our specialties are going to be in voice and neurological disorders. And we're also the second Hartford Healthcare location to offer gender-affirming voice therapy, the first being in Norwich.
And how long do speech pathologists typically work with their patients?
You know, it really depends. It is therapy, so it's a course of treatment, but someone who has chronic cough may see us for a few sessions, but if someone has a stroke and they have multiple dimensions being affected, then that's definitely something that we need to extend treatment to a few months or more.
And can I ask a final question? For parents, you mentioned kids, and that is what we usually think about. How would a parent know if their child might benefit from speech therapy?
Well, again, children are usually seen in the schools. They're not usually seen by medical speech-language pathologists. So the school would probably recommend them for that. But for adults, they would see their doctor, and the doctor would refer them to us.
All right, good information. Sarah Gromko, speech-language pathologist at Hartford Healthcare. Thank you very much for all the information on the new program.
Thank you for having me.